University of Minnesota. And then after a year, we moved to Michigan State University. So yeah, that happened in 2017. So that's just a little update on that. So yeah, my journey started with regards to bovine tuberculosis soon after my DVM, when I started working with DevNet consultants, and of course, a lot of my family members were working in National TB Control Program at that time. So I was able to educate myself on that aspect, and I got to know that that's one thing that we could really work on from the veterinary side and the human side, as in the form of a collaborative effort. So yeah, let's talk.
Anam.
Yeah.
So, since you are the very first veterinarian, I actually invited on my first show, and it's the first episode of my show, interaction with public and veterinary health professionals. So, thank you so much for being part of this program. So you're doing amazing job. It's been a long journey. Like I remember you as a senior in Faculty of Veterinary and Animal Sciences. So since the very beginning, you have been acting, quite mature, and you were the kind of seniors we were looking, forward, or we were looking to follow you. So that's been a long journey. So how do you summarize your journey?
I can't hear you, Shah.
Was
Hi,
it
can you hear me?
easy?
The voice is cutting out. I don't know if you guys can hear me.
Hello.
Hi. Yeah, the voice is sort of cutting a little bit, but I can hear you better now.
Okay.
Okay.
So tell me when you're fine. Okay. Now is it fine, right?
Yes.
Yeah. Okay. That's nice. Uh, okay. So like what I was talking about, like as a senior, in our university days. So you were quite mature enough, and we were always about to so like get some advice from you. So you were quite professionals, like whether it was clinic, it was the labs. So we were always getting some sort of inspiration from you. So how do you summarize your journey as a female young veterinarian? So since it is the first episode of my show, and I wanted to tell all of my young veterinarians, particularly the female veterinarians, who are quite hesitant to work in the field. So how do you summarize, like how do you see yourself today?
Yeah, well, it's been a very long journey, as you said, but it's been very exciting and very rewarding as well. I have had phases which were really tough to go through, but the end result was just incredible. So I don't have any. Um, I'm just really happy that I had this opportunity to become a veterinarian and then to practice veterinary medicine and to get into different aspects of public health as well as animal health. So yeah, definitely long, fun, but very rewarding.
Okay, that's nice. Okay, so being a female veterinarian, do you think when we watch in terms of Pakistan scenario, the conditions, they're not pretty cool. Like the way we see in the Western countries, particularly you are staying right now in US and I'm staying here in Turkey. So the things are better and more feasible here in the Western countries when we compare with the Pakistan scenario. So like, how do you think it was easy? Were you comfortable enough to work in Pakistan scenarios, like as a veterinary officers?
Mhm. Yeah, I think the the empowerment comes from the people that you're surrounded by. So like my family have always been very supportive of me in terms of working and pushing my limits, and they've never sort of like stopped me from doing anything. And I've been very blessed, and that's almost like a privilege for me, that I've been in a privileged situation where I didn't have to face a lot of issues or sort of restrictions from my family. uh, but the problem is more like in terms of not the veterinary medicine, but the problems arise from being a woman in a Pakistani society. So the moment you step out of the house, there are certain issues that you have to face on a daily basis. So I come from from a middle class family. I always traveled by public transport. I still do. But the things that I had to face like two times a day, traveling in two or three different vans, and then Suzuki and all of those things, I feel that for me was much more difficult than the veterinary science itself. For me, when I started the vet school, I was really lucky because I got some excellent friends who were very supportive. They didn't say it's like, "Oh, you're a girl, back off. Like, you don't have to go into the clinics, or you can just sit with us and we can just chit chat." They were like, "No, it's like time to go," and like, and I was always very excited about working on the clinics, and I was lucky that I got surrounded by people who were like very supportive. And I think I'm starting to sound a bit redundant saying that word, but then I also ended up having teachers who were who believed in me irrespective of what my gender was. I think that was very important. Even when I started my job, people didn't give me any less amount of work or any more work just because I'm a woman. They were like, "You're a veterinarian and that's all that matters." And I think when you yourself have that mindset that you're just a person working, I think that helps. The moment you start feeling like, "Oh, I'm a woman, I can't do something," that's when it becomes a bit problematic, and that's what holds you back. So for me, I never had that issue. Of course, just traveling and the amount of work that you have to do in the field, it is difficult. I'm not going to underplay that. But just because a woman, but just because you're a woman, does not mean that you have to sort of like step away or let other people lead while thinking that, "Oh, you're a woman, you can't do that." No, no,
Oh, that's nice.
yeah.
Okay. So like post your university days and since your MPhil studies as well. So you have been associated very much, with the bovine tuberculosis. So, our members, particularly from this Facebook page, the mostly they are veterinarians. So what is, obviously, so like we know somehow about this disease, like what is actually the bovine tuberculosis, and how did you get associated with this kind of disease? Like what was your inspiration working on such big issue?
Yeah, so my first introduction to the disease was obviously in our vet school. We read a lot of zoonotic diseases, we have major focus on that. But truly, when I stepped out of vet school, I attended this meeting with some National TB Control Program officials. I was just working as a reporter, and I attended just one meeting as a reporter, and I was asked if tuberculosis happens in animals. That kind of took me aback because I was like, shouldn't we know that? But I realized that that's an information gap that existed. Then I was very fortunate that I ended up working with Dr. Ayaz Kiani at DevNet Consultants, who is a pharmacologist, a public health professional, and he was working in close collaboration with the provincial TB control program at that time. And through his mentoring, I really got educated about the information gap that existed between the human side and the animal side, and how we needed to bridge that gap. Because as we all know, bovine tuberculosis is a zoonotic disease that affects humans. And about 1% of all pulmonary TB cases in the world are caused by bovine TB. Um, and that's very important because by 2035, in about 15 years, we are aiming to have a TB-free status in the world. But how will we do that if we don't incorporate the veterinary side and the human side? We need to take into consideration both of these things. So all of these discussions we used to have back then were, they really informed me and sort of set me on a path that at that time I felt like, I don't know if I would be able to stay on that path. I don't want to move away from veterinary sciences because I really love working with animals. But I did realize that, if given an opportunity, everybody should play their part. And I felt that I could play my part by being on this path. And of course, Dr. Yasyani pushed me to enroll in a master's, MPhil as we call it in Pakistan, in epidemiology, public health. I'm so grateful to him for that. And not just that, my family members work in National TB Control Program as well.
Oh, that's nice.
And yeah, and they were really supportive. They're like, Anum, you really need to go and do something about it because, as a team, we can really work together and bring about some changes. And so, yeah, that's what triggered the entire journey, I would say. With regards to what bovine TB is a disease. It is a chronic, infectious, debilitating sort of a disease that occurs in animals and can be transferred to humans. And we can discuss in detail about this disease as the interview.
Okay, I have a major concern, I don't know. So since I am also a veterinarian, so I'm concerned about like how do the cattle they catch this disease? Is there kind of any carrier that is acting, to get all the cattle infected from this disease? So like, what is that carrier thing? Or how do they are very restrained animals, or if you talk about the controlled house, like the cows, they're not going out except for the grazing, so how do the cattle actually they catch tuberculosis?
Yeah, so bovine tuberculosis is caused by the bacteria Mycobacterium bovis. And because of its chronic nature, it is detected really late. The clinical signs and symptoms come up really late, almost at the end of the stage of this disease. You asked about the vehicle. Now, it's not really a vector-borne disease, but it is endemic all over the world, except for a few countries. So even if we just talk about Pakistan, we do have different reports suggest anywhere from like 1% to 13% prevalence of this disease in the country. The problem is that this is an infectious disease. If an animal coughs on a water trough or on its feet, or the animal defecates or urinates, and the bacteria is being shed in all of these sorry, I got a bit distracted. Yeah, so the bacteria is shed through all of these sources, and the bacteria is very stable in environmental conditions. There are studies that have suggested that the bacteria can stay stable in moist conditions up to about like 3 months or so. So if you even have one animal in your herd that is infected, and it goes out, let's say, urinates in the pasture around itself, or coughs, or it's even in a barn where it is interacting with other animals, it will transfer the disease. So what we really need to do is to detect this disease really early on in the infection. And to do that, we need improved diagnostics for that matter.
Hmm.
So that's how it's spread, like through
Okay.
fomites, through nasal discharge. Um, yeah.
Uh, I got it. So like in a farm conditions, like my question is very related, very much related to the answers you have already given. In a farm related conditions, so like how do you think, is it quite feasible to detect this disease? So like since there are a lot of animals in the herd, so like so in those conditions, like how can you see from the physical sign and symptoms, or maybe from any test, a kind of rapid test you perform? So how do you detect in a big herd, particularly like at commercial farms?
Yeah. So the present diagnostic tools that we have, they include tuberculin skin test. That's for screening of this disease, and that's done. That has to be performed on the entire herd, irrespective of the size of it. Over here in US, we have herds as large as like 1,000 animals, right? But tuberculin skin testing is done, regularly to identify even a single infected animal. Then we have parallel tests such as interferon gamma release assay, or as well on the research side, we have the dual path platform assay or the multi-antigen print immunoassays. But for field situation, we have tests such as just tuberculin skin test. And that's where a lot of issues exist because tuberculin skin test does not differentiate between Mycobacterium avium or Mycobacterium bovis. So when you first go into a herd and you don't know the exact prevalence of Mycobacterium avium in your area, like in Pakistan, we don't really know exactly. So you have to perform, comparative cervical tuberculin skin test. That is labor intensive because you need to restrain the animal first. Then you have to, one person has to ensure that it's, properly restrained, and then the other person has to go in and inject tuberculin, avium tuberculin, and then bovine tuberculin on two different parts of the neck or the caudal, if you go towards that. Um, it's labor intensive, it's expensive, it's time consuming because the results come in about like 72 hours post injection of the tuberculin, and then the same veterinarian has to go back and then test the inflammation at the site of infection, at the site of injection. So this test is not easy to perform on large herds. That's a valid
Absolutely.
concern that we have right now, and that's exactly what my lab is trying to change. And we are trying to develop a new diagnostic tool which is more like easier to perform, which is field based, it is stable in the field, and it is very specific to the infection. Because even with tuberculin skin test, we have the issue that it depends or it relies on the animal's ability to generate sufficient immune response. And if the animal is not in the state to do that, if it's in a state of anergy, or if it's a really young animal, or if the cow is in postpartum, then our chances of getting a positive result is,
I
it
think.
might not happen. So those are the issues that exist with diagnostics. What was the
So
other
like,
part of your question?
Anam, I very much agree with you. So like when we look in, when we consider the developing conditions, or the conditions in the developing countries, particularly like Pakistan. So I'm sure, like you might have a lot of friends. I do have a lot of friends who are working as a field veterinarians, or who are working in the slaughterhouse, like as a meat inspectors. There are some concerns associated with the meat consumption, with the byproduct consumptions, like kind of dairy product consumption from the animals. So, how do you think, like this phenomena that we have, like if we cook the meat properly, or if we, process the food properly, then so that there are not chances of getting any, zoonosis from this bovine tuberculosis. Do you agree with this, or would you like to elaborate about this topic?
Yeah, I do agree with that. In fact, studies have shown that when milk or dairy products are pasteurized before consumption, it eliminates the chance of you getting infection from this zoonotic infection. So the first thing that we would have to start doing is pasteurized milk, pasteurized yogurt, pasteurized cheese. Cook our food really well. Thankfully, we already do that. But it doesn't stop there, because you could be getting, for example, in our country, we get milk delivered directly from the farms to the houses. And while they're pouring the milk in your vessel, a few droplets are created. What if that particular milk was infected with Mycobacterium bovis? You could end up, inhaling it. You could end up having some, droplets on your face, and just, out of human nature, you could just rub your face, and then you end up having that exposure. So you see, the entire chain of the food supply has to be managed. And if you don't do that, then even if we end up having really well cooked food, well cooked meat or dairy products, there is a little bit of chance that you could end up having infection. Also, I've seen, when I was working myself in Pakistan, a lot of times, and it used to scare me like anything, I would go to a farm, and one of their cattle would end up turning positive on tuberculin skin test, and then they would offer, just to show to me that they would just make their children drink raw milk from the cattle, and that suggested that, oh, it's the healthiest form of milk that you can consume and nothing's going to happen. What if your animal is infected with Mycobacterium bovis? You don't know. So, apart from rigorous testing that should be done in a country with regards to bovine tuberculosis and removal of infected animals, we need to focus on the meat and milk supply chain to ensure that this disease is not transferred from the farm to our household.
Okay, thank you, Anum. I would like to ask another question, so which is very important, relevant to Pakistan's scenario. I don't know exactly about the prevalency of this disease in Pakistan. So since there are mixed reports, or the owners, they actually don't want to cull their animals. If it is diagnosed with the tuberculosis. So how can we eradicate this disease? So when we look the scenario of developing countries like Pakistan, is there any country that has got the status of tuberculosis, bovine tuberculosis free? Or can we do this one in our current scenario, taking care in mind the conditions of Pakistan?
Mm-hmm. Yeah, so to answer first part of your question, there are certain countries that are free of TB, such as Australia, Iceland, Greenland, Singapore, and some European countries, European nations, and Israel. But they didn't do it overnight. It took decades of concentrated efforts to actually reach that status. And then to maintain that status, they had to have the right kind of policy and legislature that prevented reintroduction of the disease in their country. Unfortunately, we are not at that position right now in our country. I wish we could, but we are not in a position where our government could support the test and cull strategy, because if even a single animal is found infected in a herd, the entire herd has to be culled, right? How can we, support our farmers in that situation? Because then you need to bring in animals, or at least give money to our farmers so that they can purchase new animals. To have a nationwide strategy of test and cull methodology, I think that's very difficult right now, or almost verging on being impossible. But let's not say that. Nothing's impossible.
Okay.
What we can start off with is, pasteurizing milk and improving our, eating habits.
Okay, so one question I would wanted to ask from you is I'm sure like your area doesn't cover that domain or that area. So like the question is related. For example, we know the zoonotic status of this disease. So if a person or if a field veterinarian get infected with this disease, so like what kind of physical symptoms or physical sign and symptoms we get after having this disease? Obviously, we know that this disease progress slowly, but what kind of symptoms are associated with this one?
Yeah, that's a good question, Shah. So you see, it depends on the route of infection. So if the veterinarian has been exposed through aerosols, if the veterinarian was interacting with the infected cattle that ended up coughing, or they were in a very small barn, um, chances are that the veterinarian would end up having the pulmonary form of TB. Um, but if it was more through consumption of raw milk or undercooked meat products, then he would more probably end up having the extra pulmonary form of TB, most probably the gastrointestinal form of TB. And funny thing is that the clinical signs and symptoms of the disease caused by Mycobacterium bovis, which causes bovine TB, versus the clinical signs and symptoms of human TB caused majorly by Mycobacterium tuberculosis are actually the same. So you can't really
Yeah.
differentiate. So if you're having, just the same symptoms such as recurrent fever, you have cough, you have weakness, there's loss of appetite and weight, there's fluctuating fever, there's dyspnea, there's intermittent or hacking cough, there's low-grade pneumonia, fever, diarrhea, enlarged lymph nodes, all of those things, you need to go to a human doctor, and you need
Okay,
to,
that's nice. Okay,
rely
so
on.
like I understand. Okay, thank you so much. For so detailed answers. The last question I would like to take from you. So like obviously you're busy, and so one last question. We have now this concept of integrated health approach or one health concept. So like keeping in mind the security of food chain, we have the role of veterinarians, the role of public health professionals. So like how important is the one health approach in keeping our food chain secure?
Oh, it's extremely important. In fact, it is that one concept that we are relying on to actually control zoonotic tuberculosis. And we've seen this work really well in other diseases, such as right now, COVID-19, or, other diseases such as like we saw it in dengue control program, where the entire country came together and all the different departments came together to try and control this disease. And that's one of the things that I did when I was a veterinary officer in livestock department. One health approach is critical to control this disease. We have to start engaging, the people who are at a higher risk of getting bovine TB, so like the farmers, the veterinarians, the butchers, and we have to do baseline research, because without baseline research, we will not know exactly how much this disease is being transferred from animals to humans. And for that, we need to collaborate with the human side of the tuberculosis control program. So a collaborative effort is extremely important right now. And One Health is the way to go. I mean, there is no other way out of it.
Okay, thank you so much, Anam. It's really a pleasure having you on the show. Now, in this last part of the section, I would like to take some, I would like to take some questions if there are any, and I would like to share some insights with our audience. The first question I wanted to ask, if you are reading on your screen, I don't know, it is from Dr. Tariq Zaman. He's a good friend of mine. So he's
Yeah.
working on PhD neurosciences in
Mhm.
the same university, and I would like to interview him as well. So he's asking, some kind of personal
Yeah.
information. You may contact him later. Okay.
Sure.
Yeah. Okay. So we have Sahil John. Sahil John is saying hi. Okay. So I wanted to share his comment. Okay. So we have Fahad Khan. Qadir. He's saying, nice to see you guys. Good job. Thank you so much, Fahad. Okay, I think, yeah, it's from Ayaz Magsi. Do we have to cull the calf of mother cow who later will be diagnosed with the paratuberculosis? That's a nice question. And how would you respond to this question?
So, paratuberculosis is not my field, and I would not like to answer that. Paratuberculosis or Johne's disease is caused by Mycobacterium avium paratuberculosis, and I don't know enough about that disease to actually comment on that. So, I'm sorry, Yaz, but I
Okay.
can connect you with my lab mates who actually work on Mycobacterium avium paratuberculosis. So, if you're interested, I can connect you with the right people.
Okay. So like we have around 21 people who are watching us live. Guys, if you have any question, you can just add in the comment section. So we'll be reading your comments as well. So Faraz Jamal, he was actually my batchmate. He's saying hello. He's saying good looking. Thank you, Faraz. So we have. So I was expecting like few more questions from this session, but since
That's okay.
yeah,
We
I
can answer one of the first that Dr. Tariq was asking about what I'm doing and
yeah
where I'm doing. So
yeah.
I should have said it earlier on. I am at Michigan State University and I'm in the Department of Pathobiology and Diagnostic Investigation and in the program called Comparative Medicine and Integrative Biology. That's a mouthful. But I am working under the mentorship of Dr. Shinant Shivatsan, who I was uh, introduced by Fulbright. I'm so grateful to Fulbright for connecting me with Dr. Shinant Shivatsan because under his mentorship, I've been able to truly learn about different aspects of bovine tuberculosis. So yeah, that's my introduction.
Okay, so we have, I think, another question. Tell us about interferon gamma release test. So it's
Yeah,
like
what would you
from
like?
Muniba Ahmed. Yeah.
Okay, so it's more of an open-ended question regarding interferon gamma release test. What should I tell you about it? Gamma interferon release test is dependent on the cell-mediated immune response. So it depends on the memory of the T cells to generate interferon gamma. So if previously the animal had been infected with Mycobacterium bovis, once the T cells are stimulated by the antigens that are specific to Mycobacterium tuberculosis complex, then the cells end up secreting interferon gamma, which is then detected in ELISA sort of a format, in indirect ELISA. The problem with this particular test is that it is dependent on the host's immune response. Again, same issues as the tuberculin skin test, that if the animal is in a state of energy or if the animal is overburdened by infection, we might not get a very good response on interferon gamma release assay. So what my lab is doing right now is that we are focused on the pathogen specific biomarkers because independent of the host background, by focusing on these biomarkers that are specific to the pathogen, which is Mycobacterium bovis, we are able to detect the disease much better than it has previously been done. And we have performed multiple validation studies after our discovery. And we did validation studies not just in cattle, but we did it in deer and non-human primates as well. So those biomarkers that we are working with are PKS5 and MB2515C and MB1895C. All of them are really specific to the pathogen. And using these, we are trying to develop a new platform, a sort of like a lateral flow device for my PhD project.
Thank you
So
so much, Anam. Thank you so much, Muniba Ahmed, for asking your question. Anam, before we, so like, I think we have another question from Yasir Zahur I would like to add before we end this session. So he's an AMPhil scholar from UVAS, and he is working also on bovine tuberculosis. So, and he want a retrospective study by taking the data from hospitals, so like having confirmed TB patients, and okay, and injecting tuberculin to their animals. So can you please guide about the possibility of this research? So like he's more interested. Is this kind of studies he's proposing? Is it feasible in terms of our scenario? So would you like to respond this one,
Yeah,
Anam?
I'm sure he has some really good mentors on his team. All I can say is that as long as you have good collaborators in the National TB Control Program, I think it's very much possible to do the study. And this is the kind of study that we need, that would help us learn much better. If you want more guidance, you can contact me on LinkedIn, because this is a very detailed discussion, uh, sort of meeting question. So yeah, contact
Okay.
me on LinkedIn and we can discuss about it in detail. But yeah, I would say that
Okay.
have the right collaborators, I would say.
Okay. So thank you so much, Anam. I think we don't have more questions and more comments. Okay, so like one last thing that I wanted to ask from you. So, like we have a lot of young veterinarians who are currently, so maybe in their last year of their studies, or maybe in the, second last year of their studies. So what sort of advice, particularly as a young veterinarian, would you like to give them and to all the young professionals like who are watching us right now, as a sort of motivation, to pursue their careers in academics, in research, or in the clinics, etc. So last few words from your side.
Yeah, I would say that don't worry too much about whether you're going to get a job or not. Just focus on what you really enjoy doing, whether that be clinical medicine or lab based work or epidemiology. Just try to learn as much as is possible at this stage, because you're still an undergrad. You're not expected to know everything. Uh, but this is a good time to develop, all of the skills related to the kind of um, future work that you want to do. And just don't worry about money, job, that's secondary. If you end up working in something that you totally enjoy, you will get the money, you'll get the job. That's not an issue. And
Okay,
you know
so we have a very amazing, mentor with us, like Dr. Tanvir Ahmed. He has joined us recently, and I think he has missed some of his part. And we'd like to take some questions from Dr. Sahil John first, and then we'll come straight forward to Dr. Tanvir as well. The session is getting a bit longer than we expected, but
yeah.
okay, so let's answer all these questions.
Yeah, so
So,
John is asking any thoughts on
yeah.
companion animals being at risk of getting infected from humans or being at a bar. So the companion animals are more at risk from getting infection directly from the cattle, such as cat or dogs. And there are case reports, Sahil, regarding animals, other companion animals getting infection. Um, the transfer of infection from the human back to an animal is rare, but it is possible.
Yeah.
So we have to
Okay.
be careful. So person infected
Okay.
with TB, stay away from your pets for some time until you get properly treated.
Okay. So let me take another questions from Dr. Tamir, I think. So like Dr. Tamir is asking, so like he needs suggestions for safety of female while doing routine course and handling animals in Pakistan. Yes,
That's
Anam.
such an important thing. And Assalamu alaikum, sir. I'm so glad you could join. It makes me so happy. With regards to safety of females, I think safety in general for all veterinarians, I would say, practice really good hygiene, have your personal protective equipment, use your face mask every time you're interacting with potentially infectious animals. You don't know which animal might be shedding or not, so make sure you are like properly covered. Your clothes don't get contaminated by animal feces or urine, or even saliva. you need to be careful with regards to that. So always wear your gloves, have your personal protective equipment on, wash your hands every single time after touching the animals. That is such a small thing that we kind of ignore sometimes. Like, oh, we can just put some disinfectant on, a hand sanitizer on, and that's good enough. It is, but it's better if you actually thoroughly wash your hands. In fact, I feel like this unfortunate event of COVID-19, it is actually pushing us towards better hygiene practices. And if we can just follow or integrate those basic measures in our daily life as a veterinarian, I think that could drastically improve our safety, I would say.
Thank you so much, Anam. So, like, we have Dr. Abu Bakr from, I think he's from NVL, if you remember.
He was our teacher.
So like, he's our teacher. Thank you so much, Sir Abu Bakr. Sahil is saying thank you. Okay, I think we don't have any more questions. So, like, I would like to wind up, this session. We have another question. I think if you don't have this question, this is from one of fellow from, it's from Dr. Mohsin. Thank you so much, Mohsin. Thank you for having me on the show. Okay. And okay. So Dr. Tanveer has some suggestion. I think, thanks for such nice talk. We always don't care for PPE and other safety. Yes, I second your opinion, sir. So, like, this is the most important part. So, like, we need to work on. We actually don't care about personal safety, which is very important, actually. Thank you so much, Anam. Thank you so much for having you on the show. It was really, amazing experience. And thank you so much for the time you managed, actually, like, on the very short notice. And we would like to continue this show to all of our audience, like, who participated in the comment section and who are watching us live. Thank you so much for joining us. I would like to update about the next episode of this show in the coming sessions. We'll have these amazing, veterinary and health professionals across the globe on this show. So please stay tuned and, like this page of Faculty of Veterinary and Animal Sciences. You can get the update on my personal Facebook page, and you can also sign in, or you can also tune the YouTube channel we have, which is about the veterinary health professional. So this was the first episode of interaction with public and veterinary health professionals across the globe. Thank you so much. We are signing off. Thank you so much, Anam.
Bye.
See you.
Thank you.